It's really a big honor to be in Montreal for various reasons. And we have had over the years many interactions with the people from Montreal, from your institute, and it has always been a pleasure for us. It is also a pleasure for me to be here because I hope that over the next future we have a possibility to do more interactions. And I wanted to learn a bit how your institute is working and what we can learn from you. We, meaning the Finnish Institute of Occupational Health. Finnish Institute is a national institute which covers the whole country of Finland. And as you can see from this map, Finland is a more northern country than what Quebec is. We have less light as compared to the Montreal regions in here. But I think that we also have a lot of things in common. And I think that there are various reasons why we should also discuss the topic of interest together to see that how we can communicate even better in the future. Finland is part of the Scandinavia in the sense that our western neighbors are Norway and Sweden, so Norway is here, Sweden, and then we have a very large eastern neighbor, Russia, which goes up to here, as you know. Finland is a small country, population-wise. Country-wise, I mean, we are covering quite a lot of ground, but much of the country is not very much habited. So the people are mostly living in the cities in the south. So it's altogether a bit over 5 million people. Workforce is altogether about 2.7 million. Employment rate is currently around 68%, and the unemployment rate is between 8 and 9%. And we have been really suffering from this global economic crisis. The official age of retirement is between 63 and 68. So when you turn 68, you have to retire. You can retire any time between 63 and 68 years old. But in practice, the retirement actually takes a lot earlier. And this is mainly due to the disability-based retirement. So people cannot continue working because of some disability. And this is the reason that the expected effective retirement age for someone who is 25 now is about 58.9 years. And for someone who is currently 50 years, it is the expected effective retirement age is 61.7 years. And these are the figures which the government very much would like to see increased. And this is also one of the tasks what the government has been giving to our institute, to find out the ways how you can decrease the share of the disability pensions from the old age pensions, so that more people would continue at least until the age of 63 and work happily even thereafter. So this is the big order from the government, and the government has been telling us that is the first and about the only measure, indicator, what they are using when they are evaluating our institute in 5 years' time, in 2015, that have we been able to do something which enables the people to work longer, and that we would get down the disability pensions, and also would get also down the sickness absences. So this is the task which we have been thinking, and how to implement actions and programs, and what to do in order to achieve these tasks. Because altogether you can see that, you can count that about 500,000 person years are being lost every year. The disability pensions take about half of that, 256,000. The premature deaths, 158,000, and sick leaves altogether. With the prevalence of sickness absences of today, that's about 64,000 person years lost in 1 year. If you can influence some of these, it also a big economic benefit to the whole society. This is also leading then to the next question, which is our population age structure. So the demographic change is taking place very quickly in Finland. At the moment, we are at a level, if we look for the children under the age of 15, so the number of children which we have today, so those who are 15 or lower, is lowest since the end of 18th century in Finland. And you can see that, that there is an expected huge increase in those populations which are over 65 years of age. So that the dependency ratio, so dependency ratio meaning that what is the number of people, everyone who is taking part of the working life must actually handle, provide the support for, is tremendously increasing in the next 30 to 40 years. And this is of course a challenge to the economy of the country, and this is again an argument that if we can find ways how people would stay longer at the working life, because then it would diminish this part of the population which is actually supported by those who are actively taking part into the working life. Finland is about the most serious, in a most serious situation amongst the European countries, and the European countries altogether have the same aging problem coming in different phases. Finland and Italy are probably those leading the situation, but other countries will follow. So the main concerns in Finland now, based on this general situation, are the following. First of all, it is important to work longer. So the longer work careers are essential. The government calls for earlier entry into the work and later exit from the working life. And further problem to this current situation is that because of the economic crisis, global crisis, so there has been a tremendous loss of workplaces and possibilities to work. So currently these two tendencies are very much against each other. So economics is doing badly because of the global economic crisis, but at the same time we should find ways how people would to work longer. Then if we look for the disability pensions, and where are they coming from mainly? So there are two main groups of diseases, musculoskeletal diseases and mental disorders. And out of the mental disorders, it is the severe depressions which are the most important. So these are the two categories of diseases which need special attention in future. And those are the disease categories which we are going to concentrate on. Also, the occupational accidents were increasing during the period when the economy was doing very well. Now when the economics has been going down, also the occupational accidents in the recent statistics have gone down. So because of there are less possibilities to have accidents in overall. And then I think a public health thing which also reflects to the occupational situations is that alcohol drinking and binge drinking seems to be a special problem in Finland. So alcohol is the #1 killer of the working age population, and the working age population here is between 15 to 64. So if we can do something also to diminish the alcohol problems, the health problems from alcohol drinking, that has a consequence also then on work participation, and it's an important public health issue, but it is also an important occupational issue in the sense that it is much of the sickness absences can be related in one way or the other to alcohol, and then the early deaths from alcohol are very important.